Good morning, everyone, and welcome to the first Hub webinar for 2020. And the title of this webinar is Strengthening Caribbean Cancer Registries. And of course, this is an ongoing initiative of CARFA and of the Caribbean Hub towards improving cancer surveillance in our Caribbean region. So there are many faces here that we know that we've worked with over the past 5 years, and Glenys is going to give you some more information about the work that CARFA does and the work that specifically the work that the Hub does in the first presentation for this webinar. But we wanted just to learn a little bit more about who has joined the webinar. So there's this link. I've just put it in the chat. If you go to the chat, you'll see that the link is there. And what we're going to ask each of you to do is to click on this link, please, and give us a little more information about yourself so that we know we're able to contact you if we need, and we know who has been able to join us today. Okay, so again, this link, you're not able to click on it from the presentation slide, but it's in the chat. So please go and click on the link and enter your information for us, please. We would have liked to have had each person introduce themselves and tell us a little bit about yourself, but we have a lot of people on and that would take our entire hour. And so I'm just going to give everybody 2 minutes to fill out that survey. And while you're doing that, I'm going to talk us through what our agenda is this morning. So as most of you know, there are a few faces that I don't recognize, but as most of you know, my name is Sarah Cannell Crooks. I have been at CARC and then CARFA for many, many years. I began in health information. I'm a statistician by training, but I'm now the program coordinator for the IARC Caribbean Cancer Registry Hub, which is based at the Port of Spain campus in Trinidad and Tobago at CARFA. And Glenys is going to give you a lot more information about the IARC Caribbean Cancer Registry Hub in her presentation next, when she updates you on some of the work that we've been able to complete since our inception 2015. And then what we have planned moving forward. During this webinar, we're also going to hear from Valerie Miners, who's the head of the Bahamas National Cancer Registry, and she's going to give us, she's going to give us a presentation on the initial experience in the development and outcome of the Bahamas National Cancer Registry. And this was an abstract that Valerie submitted to the the North American Association of Central Cancer Registries, NACA. They were having a conference in June of this year, which of course has been canceled due to COVID. This was one of 6 abstracts that was submitted from our region. And of course, this conference was canceled, but we wanted to ensure that the persons that submitted abstracts, really the time and the commitment that went into generating an abstract, that they had an opportunity to present it. And that's why we've included this, and as we do other webinars, we'll include some of the other abstracts that were submitted and give persons a chance to present on the abstract that they developed. And we've also asked the acting cancer registrar for the National Cancer Registry in Trinidad and Tobago, and Casey Felix, is going to give us a status of ongoing activities in her registry and how it's been impacted by COVID-19 and the response to COVID-19. And we hope that this will generate a lot of discussion, and that there should be, or there will likely be, a lot of similarities of what's going on in your cancer registries. And we can hopefully learn from her experience, as well as offer additional ways of dealing with this very unprecedented pandemic that we're all living through at the moment. So we'll have an open discussion, and then we'll have a closing and evaluation of the session, where we hope you will let us know how we've done. So I think everyone should have had enough time to complete that short survey. I hope you did. For those that didn't, who just joined, there is a link in the chat, and we'd really appreciate if you took the time to complete that link and tell us a little bit about yourself. Because as I mentioned earlier, we probably don't have enough time to introduce everybody on the call. Okay. So next, we'll go straight into a presentation by Dr. Glenys Andel-Brayton. And Dr. Andel-Brayton is an epidemiologist. She's the Senior Technical Officer with responsibility for non-communicable diseases at the Caribbean Public Health Agency, or CARFA, which is located in Port of Spain, Trinidad and Tobago. She has extensive experience in the area of public health, having both worked at national and regional levels in the Caribbean. Dr. Andel Brayton provides technical support in NCD surveillance to 26 countries in the English and Dutch-speaking Caribbean, as well as Haiti. As principal investigator of the IARC Caribbean Cancer Registry Hub, which was established as part of IARC's Global Initiative for Cancer Registry Development, which you'll learn about more in a second. She works with several regional and international partners, including the International Agency for Research on Cancer, the US Centers for Disease Control and Prevention, CDC, which many of you are familiar with, the National Cancer Institute, NCI, and the North American Association of Central Cancer Registries, NACA, with representatives from all of these agencies are currently on our call. And she works to strengthen cancer registration in Caribbean countries for improving cancer surveillance in the region. Dr. Andel Brayton is also involved in conducting research on NCDs, including cancers, as a means of strengthening the evidence available for supporting decision-making to improve public health in the region. So I'm going to hand over now to Glenys. I'm going to stop sharing. So Glenys, you can go ahead and share your slide set and take us through your presentation. Wonderful. We're seeing it.
Hi, good morning, everyone.
Perfect.
Thank you all for joining this, our first cancer registration webinar. So as you see, the title of my presentation is Strengthening Cancer Surveillance in the Caribbean. So as you all know, cancer is a huge public health burden for all our countries and globally as well. And data from IARC, which is shared on the Global Can website, is projecting that in 2018, cases will move, new cancer cases that is, will move from 18 million to 29.5 million by 2040. What is interesting is that the majority of the future burden of cancer will occur is projected to occur in under-resourced regions like our country. And you have the reference at the bottom of the slide, and these slides will be shared with you after the webinar so that you can then follow up if you want to read more about the projected cancer burden for globally and within our region. We have done some work on using the data that's available to us in our region, and that's mostly, that's mostly mortality data. And by analyzing the data available, we identified, as we mostly knew, that cancer is the second leading cause of all deaths in our region. We compared what's happening with cancer deaths in our region to the region of the Americas as well as the region of the US Caribbean countries. And we've identified that our countries are among the worst affected in the Americas. For example, cervical and prostate cancer age standardized mortality rates are 2 to 9 times higher in the English and Dutch speaking Caribbean compared to the United States. What is interesting is that cervical cancer is a largely preventable disease. So there's a lot that we could actually do to prevent this cancer in our region. So we have a long way to go. Most of you will know that there was a meeting in 2011 when the world paid attention to the overwhelming burden of non-communicable diseases globally. Of course, the impetus for this work came from the Caribbean because even before 2011, in 2007, we had our own meeting on NCDs when our prime ministers of the region, of the CARICOM region, actually got together and decided that they needed to focus on NCDs. Out of the 2011 meeting, though, a framework was developed by the WHO, the World Health Organization, to try to identify indicators that countries would monitor, with the hope that by doing that, they would be able to reduce the burden of NCD by 25% in terms of reduced premature mortality by 2025. So that's overall. But what is interesting here is that there is a focus on reducing deaths from specific NCDs, premature mortality from cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases. And that's to be reduced by 25% by 2025. So you see cancer is featuring there. Also, we are also going to be monitoring the new cases, so cancer incidence by type of cancer as part of this global monitoring framework. So it behoves us then to develop and strengthen our surveillance systems for cancer. And surveillance is the systematic and continuous collection, analysis, and interpretation of data, closely integrated with the timely and coherent dissemination of results and assessment to those who have the right to know so that action can be taken. So collecting the data, analyzing the data, interpreting the data, and creating information for action. So a surveillance system includes a functional capacity for data collection, analysis, and dissemination linked to public health programs. And what is important here is that cancer registries are one of the most developed disease surveillance systems in the entire world. So there is a mechanism established for collecting data on cancer. And that is done chiefly through the implementation of cancer registries and, most importantly, population-based cancer registries that can give us information on the population being served. So a population-based cancer registry records relevant information on all cases of cancer diagnosed within a target population. It facilitates continuous systematic collection of data on occurrence, characteristics, and outcomes of reportable cancers in order to assess and control the impact of cancer in the community. It allows the identification of cases from a defined coverage area, allowing the calculation of incidence rates or new cases of cancer, rates of new cases of cancer, assesses the current, and it can predict the future burden of cancer. And of course, it will monitor the impact of interventions implemented for the prevention and control of cancer in a specific defined area. So with all of this, cancer registration is therefore a critical element of a cancer prevention and control program. So it provides access to reliable, high quality, population-wide data on cancer cases. And with that information, we are able to monitor cancer occurrence and prognosis within a population and over time. It enables intervention programs such as treatment, screening, and screening programs, and helps to be able to evaluate them for efficiency and effectiveness. So what about cancer registration in the Caribbean? So we do have a long history of cancer registration in our region. And this slide, which is adopted from a publication which is currently in press that we just prepared, called Cancer Registration in the Caribbean, identifies a timeline for the establishment of cancer registries. What is important here is that we have different categories of cancer registries in our region. We are aiming, and that's one of the purpose that the hub was established, we are aiming to improve all cancer registries to become high quality, population-based cancer registries. To date, up to now, we have our first established cancer registry being in Puerto Rico, and that's a high quality cancer registry. The next was developed, the other high quality cancer registry is in Martinique, and that was established in 1983. We also have population-based cancer registries, which we are supporting and working with to develop into high-quality cancer registries, and those are, there are such population-based cancer registries in Cuba, Curacao, Bermudas, USVI, Guyana, Trinidad and Tobago, Bahamas, Guadeloupe, and Barbados. And we have population-based registries under development in the BVI, Aruba, Jamaica, and Cayman Islands. So there's a lot going on in cancer registration in our region. So what about this IARC Caribbean Cancer Registry Hub? This hub was developed as part of the Global Initiative for Cancer Registry Development, which was developed by the IARC, the International Agency for Research on Cancer, which is a specialized cancer agency of the World Health Organization. And this was done in 2011. Remember, I told you we had the high-level meeting in 2011 as well, the high-level meeting at the United Nations, when globally the problem of NCDs, the burden of NCDs was focused on, and out of that came the Global Initiative for Cancer Registry Development, because it was identified that there was not enough data from some regions of the world. So it's the first worldwide strategy to inform cancer control through the collection of better data. It's the initiative provides a commitment to address inequities in underserved countries. It targets more than 85% of the world population, 6 billion people in more than 150 countries. And the vision of this initiative is to benefit patients by reducing barriers in data collection to produce stronger evidence to guide action, to guide program development. It is facilitating the training of a new generation of professionals to better integrate with policymakers. And it facilitates development of electronic tools to lower costs and to modernize health information systems for cancer. So we are one of 6 regional hubs. And as you see pictured here, there are hubs in Latin America, and that's the maroon, North Africa, Central and Western Asia, and that's the blue, Pacific Islands hub, which is similar to ours in that small island states, and that's in pink, Southeast and South Asia, Eastern Asia hub, and that's in green, and the Sub-Saharan Africa hub, which is in yellow or mustard. Our hub became operational in 2015 and was officially launched in 2018. It's based at the Caribbean Public Health Agency at CARFA at the Port of Spain campus. in Trinidad and Tobago, and it is a collaborative effort with several key international partners like IARC, the U.S. National Cancer Institute, the U.S. Centers of Disease Control, CDC, the North American Association of Central Cancer Registries, NACA, the Pan American Health Organization, and the High Quality Cancer Registry of Martinique, which is an IARC collaborating center. Our mission is to improve the availability, use, and dissemination of high-quality cancer data to inform cancer control in the Caribbean region. So these are just some pictures from the launch. And on the left of the screen, we have our former executive director, Dr. James Hospitalis, and Dr. Freddie Bray of the International Agency for Research on Cancer. And the plaque in the middle is what is now located at CARFA, identifying CARFA as the Caribbean hub. To the right, we have some more pictures with CMOs and those of us from CARFA as well as IARC. So what does the hub do? All the hubs work to provide training and so delivery of courses, helping to develop resources for training, directed support, which is done through site visits, consultancy and mentorship to resolve specific issues, development of networks to foster relationships between disciplines in cancer registration, and to provide information on upcoming activities, and to provide data to support cancer control interventions and stimulate research to provide better evidence. So what have we done in training in the Caribbean? We have completed 4 regional face-to-face workshops. One on cancer registration, the basics of cancer registration, one on using the software CanReg 5, one on using a statistical application, STAT, for analysis of data, and one on standard operating procedures. We have done webinars, and we have developed a standard operating procedures manual for data collection and registry procedures. And again, those are some pictures from all the work that we have done. We also have provided technical support, and in that regard, we have done in-country cancer registration site assessments. We have done such in Barbados, Bahamas, Jamaica, Trinidad and Tobago, British Virgin Islands, Guyana, and Aruba. We also have looked at data that's collected and provided data quality assessments for Guyana and Trinidad and Tobago, and we have provided CanReg 5 technical support ongoing for the customization, installation, and use. And so far, we have been working with 8 countries. We have developed networks, so we have a website. We have done advocacy and continue to do advocacy for strengthening cancer surveillance systems in the Caribbean. We are a member of the Eastern Caribbean Diagnostic Oncology Network, and that's a network which is principally for the OECS countries to improve diagnosis and care of patients with cancers. We have developed promotional materials. We have a network of regional trainers which have been trained by IARC, and we showcase the work of the hub at regional and international conferences. Not only do we showcase the work of the hub, but we also showcase the work of our countries with cancer registry. So we have worked to showcase work done in Bermuda as well as Aruba and Guyana, among others, which, as you heard, were not able to present their work this year because of the outbreak of the COVID pandemic. And in terms of publications, as I said, we have conducted research, but we have also done publications, and that's a snapshot of publications we have done in the region and even for the Caribbean region as a whole. So what do we do? What are we planning to do, and what do we have ongoing? And as we all know, COVID stopped us in our tracks earlier this year. So we had lots of plans, lots of activities that had to be now delayed or deferred. So in this regard, we have now decided to launch a series of webinars with cancer registries to review the impact of COVID-19 on operations and to share information. And this is the first of many that we plan to have from this year ongoing. We are continuing with publications and research. And I told you about a publication on cancer registration in the Caribbean that has been accepted and is in press at this time for publication in the Journal of Registry Management. It will be out in December 2020, and of course we will share the links to that publication with you. We are working with Bermuda on developing a manuscript on cancer incidence rates and trends in Bermuda. Bermuda has a well-established cancer registry with a long history. So we will work with them to showcase some of the work, the good work they have been doing over a long period of time. We are working with Martinique Cancer Registry and the OECS Health Unit to do a regional training on basic cancer registration principles for the OECS countries. We continue to provide technical support for development and implementation of a virtual cancer registry for the OECS countries. In this regard, you know that the OECS countries are small, many having populations of 100,000 or less. In those cases, it may not be cost effective to establish individual cancer registries. So we are working towards developing a virtual registry to which the countries will be able to report, so that we will have data for those 10 countries all located in one place, in one registry. We have developed a matrix of all available cancer registry-related online training courses and materials, which we will share with you so that you can access those resources for use in your own countries. And we are continuing remote technical support and provision of advice for cancer surveillance activities in the Caribbean. So that's what we are doing, and we'll be happy to answer any questions you have on the screen there or website, and please feel free to visit. Thank you again, and look forward to the rest of the webinar. So we will have questions now, if there's any that you may have, or whether you need any further clarification.
Yes, thank you so much, Glenys.
I will stop sharing.
Okay. If you have any questions, feel free to use the chat, or we have about 4 or 5 minutes. If anybody wants to, you can use your mic and ask Glenys as well.
Don't be shy, we are here to share, and no question is stupid, right? So please feel free.
Will the slides be available after the meeting?
Sure. So we'll make all the presentations available following the webinar.
Yes.
So if there are no questions, or hope persons are not shy, feel free to write in the chat anything that's not clear, anything you'd like additional information on. please let us know so we can share. This is a forum for sharing for you. So let's try to share.
Yes, and we'll have a chance at the end of the presentations as well. If there are any questions that come up, we can discuss that then as well. Okay, so our next presenter, we'll move on. So Valerie, if you want to go ahead and start sharing your slides, is Ms. Valerie Minas. She's been at the Ministry of Health in the Bahamas for the past 31 years. During that time, 29 of those years was spent in the Health Information and Research Unit as a senior statistician. Valerie and I share the same background, and a deputy manager. In the unit, she played an integral role in collecting and analyzing health data for local and international dissemination. And in the past 2 years, she says it's been an honor to be an active team player in the implementation and development of the Population Cancer Registry. And Valerie has been instrumental. She's joined by a couple of team members who I'm sure she'll mention. They've been a great team and they've been very successful so far in setting up Cancer Registry in the Bahamas. She's now the manager of the Tumor Registry. She's manager, and there's also a tumor registrar, Mrs. Valerie Sweeting, who I think is on the call as well, and so is Dr. Wesley Francis. Oh, there she is. Hi, Ms. Sweeting. And Dr. Francis is also on the call. So we welcome the Bahamas team, and we're looking forward to her presentation. We can see your slides, Valerie, if you just make a screen. Sorry, if you do the slideshow. Thank you. If you just do the slideshow, that'd be great. Perfect. Go ahead.
Good morning once again, everyone. It is wonderful to be here to share with you some of our initial experiences in the development and outcomes of the Bahamas National Cancer Registry. Joining with me is, as mentioned, is my colleague, Ms. Sweeting, who's actually the tumor registrar, and I understand Dr. Francis, who's with us remotely. So it's good to have him with us. By way of introduction, Corando and his team once said that the cancer registration data plays a major role in the design and monitoring of cancer control activities and policies. This statement was supported by the fact that cancer continues to be a top 5 leading cause of death. As indicated in this slide, we can see that malignant neoplasms continue to play a role over the years in the Bahamas when we look at our rates per 100,000 population. In our next slide, so it shows that indicating or establishing our population case-based registry, it became a strategic goal of the Ministry of Health. The registry was supported by the government through legislative bill of 2016, where all cancers are reportable and all the particulars thereof. We have a director and a tumor registrar and myself, and we have a location that's very nice and we're secured there with 3 offices. Our stakeholders have been identified and the vision for our registry was shared. What continues to also be an ongoing activity is the engagement with our stakeholders, and we had official letters sent to them that supports our efforts. And the provision was made in our health budget for the national registry, which is also supported with our CNCD as a line item for our health budget. Also, we're grateful for the use of the CanReg 5 program provided to us from IARC as we continue to, even though we continue to experience some technical issues here and there, the software has been instrumental in us being able to have data even here today. This proposed organizational chart of our registry is supported presently by our advisory board. As mentioned, we have our director, the board, myself, and Ms. Sweeting, who is our registrar. It'll be good to have this fully complete, but it's a work in progress. This slide shows now the key steps in planning our registry, and we want to focus right now on the type of information, the sources of our information that comes in. It has been important for us to develop relationships and gain feedback as necessary. We have our public hospitals on board, PMH, the Rand Memorial Hospital, which is on another major island. We have our laboratories and our diagnostic center. We're still in conversation with other labs, but for the most part, the major lab is talking to us and providing some feedback. We have our major physicians, private physicians on board, and private hospital is definitely on board. Our international registries, we hope to get there where we are having a relationship with them. And of course, our Registry General Department provides us with death information for cancer. As we move along to our next slide, we know that monitoring quality of data through duplication checks is very important, and CanReg 5 has allowed us to do this. And we are able to use that data to confer with the registry staff at the hospital for any issues we may have in a particular case, as noted there. Also responding to information requests from healthcare professionals, students, and other researchers, we know is an important input for, well, providing input and feedback to us in our information and where we hope to go in the future. We have better numbers now. Our next slide would also show that we're going to be discussing our 2018 data that is available and ready for us to talk about. And this is the basis for our talk here today. There were 590 cases in our database, and we acknowledge that 25% of them have died as at that particular date, October 23rd. And please excuse the screen. Public hospitals have been excellent at providing data, the Doctors Hospital. And due to COVID restrictions, a lot of our physicians, private physicians, have not been able to provide us some of the input we'd need, but we know that we have, as far as possible, really good counts now with the doctors who are on board. Our 2019 and 2020 are ongoing. Data entry is continuing in the midst of dealing with our pandemic. Our next slide indicates the distribution by sex for 2018 data, where this is not a surprise, 61% of our data is from the females, 39% from our males. Yes. These are the selected cancer cases for 2018. There's no surprise. There are 183 breast cancers. 3 of them are to males. Colorectal cancers, 71%. 64 cases were to prostate cancers. And as you can see, generally, the other selected cancers, ovary, bronchus and lung, hematological cancers, and so on. More specifically by sex or gender, correct me, total male cancers were 229, and the top leading causes for cancer cases, prostate, colorectal, and so on. For female, breast cancers, 180 cases as mentioned before. And these tend to be the leading causes of cancers for female, with 361 total cases for females. Moving right along, the study reflects the establishment of the registry and examines the preliminary data. And according to our methodology of our abstract, the timeline and process for registry activation was reviewed, and factors which influence the full development of the PNCR. We examined every activity from concept and design to full implementation. All data in the registry database from January 2018 to December 2019 was evaluated, and demographic and site distribution of registered cases were analyzed. In conclusion, we know that the registry development took a period of 5 years for our development, and legislation has been the key factor in supporting this effort. The distribution mirrors previously suspected trends in cancer, the cancer epidemiology, and public and private sector data with data exchange agreements with international registries equals the true picture of cancer burden in the Bahamas. And that's pretty much what we have to say in specifics concerning our abstract and the submission that we had prepared. We had tailored it down a little bit due to the issues that we were having with the CanReg software at the time. So we made it more specific to the 2018 data. So thank you very much for your attention. And I also wish to acknowledge my colleagues, Dr. Francis, Ms. Taniqua Adderley, and Ms. Sweeting for their contributions to the abstract.
Wonderful. Thank you so much, Valerie. That was a wonderful presentation. It's so good to hear the country perspective. If there are any questions, I see there's a couple of questions in the chat already. We will answer them at the end. We just have one more presentation, but if there's any questions for Valerie, please go ahead and put them in the chat or save them for the end during our discussion session. So Valerie, if you go ahead and stop sharing. Great. And we'll move straight into our next presentation. And this is by Ms. Nkesi Felix. And Nkesi, you can go ahead and start sharing your screen. Nkesi is from the lovely Twin Islands state of Trinidad and Tobago. She's a graduate of the University of the West Indies, St. Augustine campus, as well as Brunel University in West London, where she received a master's in science in molecular medicine and cancer research with merit. She has worked as a research officer at the National Cancer Registry of Trinidad and Tobago since 2010. And as of last December, she's been appointed extra duties as the Cancer Registrar for the National Cancer Registry in Trinidad and Tobago. She's a GICR Net regional trainer, so she's one of the regional trainers that Glenys mentioned during her presentation in the topic of coding and staging. She's actually done a couple of webinars for us in this topic, the Curbing Cancer Registry, so some of you may know her from there. She also has expertise in medical microbiology with concentration in oncology and organic chemistry, specifically in floral chemical isolations. She's also a volunteer at the Trinidad and Tobago Cancer Society. And we've been working with Nkesi since we started. She's been a great asset to cancer registration in the Caribbean, and she's so easy to work with. So we're very happy that she's agreed to present today on how Trinidad and Tobago's registry is managing 2020, how they're managing COVID and COVID response activities in Trinidad and Tobago and still operational. So go ahead, Nkesi. Thanks so much.
Hi, everyone. Thanks, Sarah. My name, as Sarah just said, my name is Nkesi Felix, and I am the research officer / registrar at the National Cancer Registry of Trinidad and Tobago. And I'm just going to do a presentation on the status of ongoing activities, challenges, and the impact of COVID-19 on registry operations for us. So I'm just going to start with a little introduction of the registry here. The National Cancer Registry of Trinidad and Tobago was established in 1994 by Dr. Elizabeth Commoner, who was also a cancer patient. It's a population-based cancer registry, and we collect data on all citizens of Trinidad and Tobago. So based on this the presentation is about how COVID affects us. One of the major activities of the registry is data collection. The registry utilizes active data collection whereby we go into sources of data and the information is collected by registry staff via data entry forms. Cancer is not a reportable disease in Trinidad and Tobago, so we actually go into the institutions to get what we need. So the usual places that we get information are the hospitals, both public and private. All public hospitals we get information from. We have the support of the Ministry of Health of Trinidad and Tobago and all the IARCs with respect to collecting cancer data in the public institutions. We also get information from some private institutions, doctor's office, hospices, pathology labs, cancer treatment centers, and we get our death information from the Central Statistical Office. The most current completed year we have right now is for the year 2017, and we are focusing on collecting data for the years 2018 to 2020. The National Cancer Registry of Trinidad and Tobago usually sees about 2,400 cancers on average diagnosed per year. So COVID, just like everywhere else, Trinidad has felt the effects and Tobago has felt the effects of COVID. The first confirmed COVID case that we saw was on the 12th of March, 2020. And the government moved quickly to close schools and put protocols in place to reduce the spread of the disease. On the 23rd of March, 2020, the country borders were closed. And at present, they are still closed. The government is managing mitigated response with respect to letting nationals come back, but the borders are still basically closed to non-nationals. On the 30th of March, it was announced that all non-essential services were to cease. So the country basically went into a lockdown. Only essential services were accessible during that period. And that lasted till about May 2020. Before then, it was a phased reopening, but basically the working sector was, especially public sector, was shut down till about May 2020. In August, we saw the commencement of community spread in the country with increase in cases, and that led to introduction of new staffing protocols to implement to mitigate the situation. So things that would have occurred then, staff would have been rostered. Some staff who could work from home were working from home. Schools were decided it wasn't going to be open in September again. And everywhere basically, where you might have had larger staff, they were working with as little staff as possible to just keep down the number of bodies in the institution at any point in time. So how did COVID-19 affect us here at the registry? Well, the staff of the Dr. Elizabeth Kwamina Cancer Registry are members of the health services, so we were considered essential, and all health protocols were implemented throughout this period, but we continue to work. We continue to work every day, both on the field and in the office. So yes, we continue to work, but there were limitations that we faced, right? One of the main limitations is the Central Statistical Office. We had to suspend data collection there on average so far for 2020 for about 4 months, 2 months earlier in the year, and then 2 months recently, which was directly due to COVID-19 protocols. That is where we collect all our cancer deaths, so collection of cancer deaths were affected. Limited support staff and medical records access at data sources, right? So as I was pointing out before, because of the community spread of staffing protocol, so somewhere that we may have had 3 or 4 people to assist us, we may have only had 1 or 2. And that would obviously have caused a little bit of a slowing down in the amount of data that we were able to collect. And then in some institutions, such as the Cancer Center, National Radiotherapy Center in St. James, which is one of the main places people in Trinidad and Tobago go for cancer treatment. Usually we may have had more than 1 registry officer visiting the institution, but because of COVID, we limited it to 1 person just to reduce the amount of bodies in the space and just persons accessing the area, right? However, on average, registry staff were able to maintain the projected quota of data collections per week. So that was good, right? So obviously, because of COVID, we had to look at ways that we could adapt to the situation. So one of the things we did, we utilized already available avenue that allowed for remote abstraction of data at the office as instead of on the field, right? As well as streamlining the data collection, right? So what it is we did, we reached out to pathology labs of the hospital and asked them if it is, they could provide the electronic pathology reports to us, right? And we also began receiving electronic medical records from the National Radiotherapy Center, which is the largest cancer treatment center in Trinidad and Tobago, that once again allowed us to do remote abstraction at the office. So what we did with the pathology report, we used it to make lists of confirmed cancer patients that were provided to the medical record staff before, so that when the registry officers arrived at the institution, they will be able to collect the data quicker, right? The information was also used to update the cancer data that we already had in the database, right? So we would have done searches through the database and identified persons we already had. And obviously the pathology report would have provided more accurate and specific data on the cancer diagnosis. Training, we were still able to get training done. We utilized the virtual conferences that were available to us. We participated in the North American Central Cancer Registries virtual conference in June, as well as the US National Association of Cancer Registrars virtual conference in September. Utilizing things like Zoom and just social distancing and whatnot, because we do have a small staff here, we were also able to do in-house training with the registry officers in essential TNM staging. Right, so overall, the registry's cancer data collection is on par with previous years. We were able to complete the 2016 death collections that we had set out to do, and we are currently collecting all the 2018 because CSO has once again become available for us to do our data collection work. And we're hoping to complete that 2018 death collection without further interruptions, at least by early, like maybe January 2021, right? Yeah, right? So the effects of COVID-19, we realize how it's going. We expect it to still be felt in early 2021, so we aim to complete the 2018 death collection and continue our focus on collecting cancers diagnosed from 2018 to 2020. And how I see for the way forward, because in this climate, one of the most frustrating things is the unpredictability. We don't know what is going to happen from month to month, from week to week, right? So we set realistic goals given the current climate. We understand that we can't collect as much as we usually do, but we just set a realistic goal to make sure that we could still collect a good amount and keep up with where we were in previous years, right? The other thing is we maintain good relationship with the stakeholders, particularly because cancer is not a reportable disease. It's so very important that we maintain a good relationship with all the places we go to collect data with respect to the staff. They actually do go above and beyond in helping us get what we need done because they understand and appreciate the importance of what we are doing, right? Keep open lines of communication with your staff and with the supervisor of the department, especially with things constantly changing. I always made sure everybody knew what was happening. They had everything they needed. If they had any issues, they could always just, come to me or like bring it up, and we could try to figure out what's the best way to deal with it. And then, of course, particularly because of how we collect data and it involves actually going into physical spaces, it's always good to look for new avenues of data collection, such as how we got the electronic pathology reports. That helped a whole lot in ensuring that we're able to keep up with the usual pace of data collection and ensure that the flow of information continued to come into the registry. Thank you so very much, everyone, for listening. Any questions? You could just put it in the chat, as Sarah said.
Great. Thank you so much, Casey. That was great. Very, very useful and informative. We do have some questions. So if Casey, Valerie, and Glenys, if you can just unmute your mics and I will direct the questions your way. I think the first is for Glenys. Are there training videos available? And I think this has to do with CanReg 5. They say that this is from Julia Rowe Porter, and that there's a need to access training videos for new team members.
Unfortunately, at this point, do not have training videos available, but there are online tools for, if it's for use of CANREG 5, there are online tools that can be made available. So new persons can actually do some online training, although there's no training video per se, but it's an online course that IARC has available. And we are also supporting countries to have training in cancer coding and so through NASA. So that's available if your registry, and I'm not sure which registry is this. Do you know where she's
Not
from?
sure. Julia Porter, do you want to say where you're from?
Could you indicate which registry is this, please? You can unmute your mic, Julia, please. Or write in the chat. Because we can connect with you after. You are from Jamaica, okay. So for Jamaica, and I think you also have participated or are participating in some NASA training. So for CANREG, there are tools online that can be used, but we also have done some, well, training with Jamaica on the ground. Unfortunately, at this point, that's totally not possible. So we can chat with you and we will see how we can support you going forward.
Great, thanks very much. There are some, as Glenna said, just a couple of videos for CANREG. So I'll share those in the chat in a second that you can access. It's on the IARC website as well, but it's not a comprehensive training for CANREG. So, but that seems to be in the works somewhere at IARC's level. Okay, for Valerie, could you share if your health system is paper-based or digital? And what is the process for collecting data? Does it come to the registry directly? Is it passive data collection, or is it active where you need to go out to the hospitals to collect the data?
Hi, yes. For the most part, it's digital, but however, we have so many pockets of data in different formats and different systems. At the moment, still being recent in our data collection exercise from our partners, we have to find a more comprehensive way of assisting the physicians or going out there and letting them know what format that we'd like to have it in, even if we have to offer the assistance with getting the digital format that we would need, even if it's the Excel sheet. And we were in the process of developing that kind of partnership with our doctors when COVID happened. And of course, all of that had to go on the back burner. For right now, one of the private hospitals, they send us a PDF format that is printed out. One day we hope to have that change where they can actually send us their Excel or use some conversion with the system that they already have to send us in a format that we can take it more easily into our system. And to date, our public system sends us, again, an Excel file. And we have to print or look at the data because it's lots of pathologies, lots of lab work, and we have to go and decipher what we need out of all that mountain of information. So it's not integrated for us to use at this time in an easy format that could be uploaded into CANREG 5 and help us in what we need. So that's part of your question answered.
Yeah.
There
was another question for the Bahamas, for Valerie. Why was it no surprise that more women than men had cancer? A couple of people wanted to know.
Oh, that's easy. My colleague, she'll address that one.
Hi, I'm Val.
Hi, Miss Sweeting.
Hi. In our culture, the ladies, they tend to do more checks than men. And especially like October is breast cancer month. And so we have different offices that women go to for mammogram, and they pay half price for it. Men in September, I think it is, they have the Me Too or Us Too program, where they have their prostate examined. But in doing that, we still have more women who have their mammogram, because we have high cases of breast cancer in the Bahamas. So women tend to check more than our men do.
So it's not a true reflection. It just has to do with who goes for testing.
Yes.
Glennis wanted to say something.
No, I was saying it's because of the screening that's done, so you identify more cases.
Yes, because of screening.
And one last question for the Bahamas. Could you indicate what your case definition is?
We report all cases. All cases are reported in the registry. We also have a hospital-based registry, and they also collect everything. So in the national registry, all cases are reported. All cases are reported, including skin.
Okay,
And
great.
actually, that's another thing I can support in, even though it's not reflected on the chart that we provided, skin cancer is pretty high here, because being in the tropics, the sun and everything, we have a lot of skin cancer here.
Yes,
And that's captured by your registry.
Yes, it is.
Yes, because I have a case now where this male, he has 3 different sites of skin cancer. So skin cancer is on the rise.
Right. Okay, great. Thanks very much. There was a question about the specific tool that's used to capture cancer data. So this varies. I'm just going to take this one. This varies from country to country, and it depends what data collection form the National Cancer Registry for that specific country has decided to implement. There are, however, recommendations. So I've just put in the chat the link to download the Caribbean Standard Operating Procedures Manual, and this has recommended variables for data collection in this manual. So you're more than welcome to download that. We hope that you do. And we can discuss that more at another webinar if that's something that people would think would be interesting. Or you can go through it and send us an email if you have any questions about it. There are a couple of questions for NKC. First, what size is your registry team?
Currently, there are 7 of us, 3 registry officers, 2 data entry clerks, an admin assistant, and myself.
Great. And what is the latest year of data collected on childhood cancer cases and mortality in Trinidad?
2017. We actually have a really good relationship with the Pediatric Cancer Registry, which is where Corey George and works. And we get data from them because all the children with cancer go to the Just Because Foundation. That's where they would receive their treatment and everything. And we have a really good relationship with them. So we get the data that they collect. So yeah, we're up to 2017 as well for childhood cases and mortalities.
Perfect. And just going back to the Bahamas for one, I know we're a little over time, but just for a couple of minutes to discuss more about your skin cancers. The question is that basal and squamous cell carcinomas of the skin that you're collecting information on?
Both.
Both?
Yes.
So skin cancer is included in your data. So that's not standard across all registries because of the amount of data that needs to be collected.
Yeah, that's why I didn't show it.
Okay, great. And Dr. Coronel, you're wondering about the difference between men and women in terms of the number of cancers?
Yes, it was explained just now by screening, but does screening make all of the difference? There are, some cancers have like lung cancer. I think I saw in Bahamas there is not a lot of lung cancer, I think. And
Bronchus,
anyway, it's not a top 3,
Mhm.
bronchus and lung is there.
but not the top 3, or is it?
No,
And
it wasn't the top 3.
most places it is. So you have symptoms.
Francis, I think, wants to say something.
Yeah, Dr.
Yeah, we breast pretty much dominates cancer in the Bahamas. Um, I think we also have a lot of prostate, but our collection is kind of limited. So I don't think the registry currently truly reflects the amount of prostate that we collect. But breasts by far just dominates what cancers in the Bahamas. So therefore, just by virtue of that, the number of women would be much higher whenever you collecting any data on it. That's just something. I mean, we have a really high incidence or prevalence of breast cancer, so that tilts it. But I think we need to improve our collection of prostate data. And I think over time, we'll see that it probably rivals the same. We don't have a lot of lung cancer in the Bahamas. Bahamians don't smoke that much. There are a few cases, but it's not significant at all.
Okay, thank you very much, sir.
And Dr. Francis is the director of the registry, and the national initiative to have a population-based cancer registry is largely came to fruition because of the persistence of Dr. Francis. And we really want to applaud him for his efforts to get this to happen, though it took much longer than was first anticipated. So thank you, Wesley. Keep up the good work.
Thank you, Glennis. It was a huge team effort, to get it to where it is right now, and I'm pretty proud of it.
We are too.
Wonderful. I think that's the end of the questions, and I know we're a little over time, but there's just 2 things for us to do before we sign off. One is just to ask you if there are any particular topics of interest, and you don't have to say it now, you can email me after, but that you would like to see highlighted in these webinars going forward. If there's something on CANREG or something on coding and staging, something to do with IARC and submission of data to CI5, anything that you think would be useful or informative that we can facilitate being presented to you. If you can let us know that, you can either type in the chat, you can email me after, you can unmute and let us know. And we would also ask that you complete it's a very quick evaluation to let us know. So I'm just going to stop sharing for a second because I'm going to put the link in the chat so that you can let us know if this was useful. We hope it was useful. If you'd be interested in, it's in the chat now. If you would be interested in attending future webinars, which we hope you would. And again, giving us just some feedback on how this was, how the experience was, and how we did. I don't know, Glennis, if you'd like to do some closing remarks, anything you'd like to say at this time?
Yeah, well, I think we want to say thanks to everyone who participated. I didn't mention in my presentation, but just so you know, we are working with many other countries that have identified their interest in having cancer registration. This includes Grenada, St. Vincent and the Grenadines, Dominica, St. Kitts and Nevis. We have already started the work with Antigua. So if there's any country that has an interest and who participated in the webinar and would like us to have a conversation with them on whatever is the interest, please do not hesitate to communicate with us. I also need to mention that we started a conversation with Suriname, and unfortunately, COVID kind of railroaded us, but we hope to get back on track soon with Suriname. to work with them to implement their cancer registry. So I just want to say thanks to everyone who participated this morning. We think that it was a great opportunity for us to re-engage with you because we really had lots of plans for this year, which because of COVID, we had to change and try to think how we can re-engage you. And this was the best that we could come up with. So please give us your ideas for topics that we could continue to discuss with you. We anticipate that we will have, barring December, we would have one webinar per month going forward. So we would announce a date for a new webinar in November. And well, we would skip December because everybody becomes engaged in holiday activities, and we would restart in January next year. So thank you all. And I don't know if anybody has, the floor is open. If anyone wants to make a comment, please unmute your mic and say something to us. Thanks again, everyone.
Thank you. Bye-bye.
Bye.
Thank you so much. And please remember to click on the link that's in the chat and complete the evaluation form. Thank you so much for attending, and thank you. A special thanks to our presenters. And we look forward to seeing you all at the next webinar, which will be scheduled at the end of November or early December.
Now, the issue here is that we would use the same format. So we are having one country to showcase who would have submitted an abstract that was accepted, present, as well as to talk about COVID and how COVID has impacted you. But please let us know if there are any topics you would like us to focus on.
We've already gotten one topic suggestion from Shelley at Barbados, TNM staging. So that's something we can look into, Shelley. And if there's anything else, just let us know. Thanks very much for taking the time to be part of the webinar this morning, and we look forward to your future participation.
Yes, everyone, please complete the evaluation.
Yes, please complete the evaluation. I keep resending it in the chat so that it's easy to see. Great, thank you all. Enjoy the rest of your day. Hope you have a good weekend.